Modern medicine saves millions of lives every year. Antibiotics, surgery, trauma care, all amazing things. But some of the knowledge behind them came from experiments that were, let's just say, very illegal by today's standards. Because for a long time, science didn't ask, is this ethical? It asked, yeah, but will it work? For centuries, doctors believed that progress required sacrifice, not metaphorical sacrifice. Actual people, prisoners, patients, the poor, anyone who couldn't really say no. And while many of these experiments were deeply wrong, some of them did change medicine forever. So today we're looking at unethical experiments that led to real medical breakthroughs, not to justify them, but to understand how modern ethics were born. Because rules usually exist for a reason. Before anesthesia existed, surgery was basically speed-running human suffering. Doctors believed pain was unavoidable and sometimes even useful. Surgeons practiced procedures on prisoners, mentally ill patients. People who couldn't refuse operations were done fully awake, with assistants holding patients down. But through these brutal trial and error procedures, doctors learned how long the human body could tolerate surgery, which techniques caused fewer complications, why controlling pain mattered for survival. Eventually, this led to the development of anesthesia, which completely transformed surgery from a last resort into a survivable medical practice. Progress? Yes. Cost? Horrifying. Before antibiotics, doctors didn't fully understand how diseases progressed. So instead of curing patients, they observed them. Unethical disease studies allowed researchers to learn how infections spread through the body, which symptoms appeared first, what untreated illness actually looked like. This data later helped doctors diagnose earlier, develop treatment timelines, understand why early intervention matters. Ironically, these studies are why modern medicine emphasizes consent so heavily, because the knowledge gained was real, but the way it was obtained was indefensible. During the mid-20th century, governments were obsessed with one question: what happens to the human body under extreme conditions? Radiation exposure studies, often conducted without proper consent, revealed critical information about bone marrow damage, organ failure progression, long-term cancer risks. While the experiments themselves were unethical, the data helped create modern radiation safety standards, cancer treatment dosages, emergency protocols for nuclear accidents. In other words, people suffered so future people wouldn't. That doesn't make it okay, but it explains why those safeguards exist today. For decades, prisons were used as testing grounds for new drugs. Inmates were offered shorter sentences, money, better conditions, which sounds voluntary, until you remember the power imbalance. These trials led to advances in vaccines, antidepressants, heart medications, but they also revealed something important. When people are desperate, consent becomes complicated. This realization directly influenced modern clinical trial rules. Independent review boards, clear risk explanations, the right to withdraw. Basically, the system exists now because it was abused before. By the mid-20th century, the medical world finally paused and said, okay, maybe we should stop doing this. Out of unethical experiments came the concept of informed consent, ethics committees, strict research regulations. Modern medicine realized that how you gain knowledge matters just as much as what you learn, because science without ethics is just curiosity with collateral damage. Here's the uncomfortable truth. Some medical knowledge we rely on today came from experiments that should never happen again. We don't honor that history by repeating it. We honor it by refusing to cross those lines again. And every time you sign a consent form at the doctor's office, you're seeing the result of lessons learned the hard way. So yeah, medicine advanced. But ethics had to catch up. If you enjoyed this video, you'll probably enjoy the next one too. I'll see you there.